Hey, now to continue our train of information, please welcome to the stage the Director of Biomedical Engineering in charge of product design and research collaborations at Vibrant Wellness, Mr. Hari Krishnamurthy.
Hey, hello everyone. Good morning to all of you. I'm Hari Krishnamurthy, Director of Biomedical Engineering here at Vibrant, and I take care of product design as well as research collaborations that we have with universities and researchers all across the world. To start, I'm going to talk about the three pillars of longevity as we look at it from a point of view of a lab. The three pillars are technology, research, and products. Under technology, I want to talk about how Vibrant picks different technologies based on what makes the most accurate test. So what I mean by that is whenever an analyte needs to be measured, there are several ways to actually measure it. Vibrant goes out of the way to look at all the different methods that are available and picks the one that is most accurate. With respect to research, Vibrant is working with a lot of third-party vendors and research partners who are enabling us to showcase the new assays that we develop. One more thing that we do with respect to research is we have a lot of internal research on the various correlations between the markers that are tested in your body. For instance, we would look at a lipid panel and a kidney panel at the same time, look at toxin testing, etc., to actually tease out the correlations that are there. Not only that, apart from the markers that are already existent, we are also constantly on the lookout for new and improved testing methodologies, which are going to give you actionable insights that's going to help you take care of your patients better. The third and final part of the longevity pillar is products. So, it's just not enough if you have a large list of analytes that you test for. It's very important that the analytes are packaged together and they tell a story to the patient and the provider. And it is also important that along with these recommendations, the story, there is a personalized solution that is provided to the individuals so that there is actionable insights that can be taken forward. And with that, I go to the technology aspect of it. So under technology, there are various technologies that we use at Vibrant to measure these different analytes, but primarily they can be divided into three. One is your microarrays. We manufacture peptide, protein, DNA, and tissue microarrays inside Vibrant, and we primarily use this for antibody-based testing. Some of you have already used our products. We use microarrays for antibody testing in tick-borne diseases, autoimmune conditions, and also for food sensitivity and food zoomers, which are pretty popular. Under mass spectrometry, that is the second pillar. For mass spectrometry, these are assays that are typically for measuring organic molecules which are less than 1,000 Daltons by weight. And this is, again, used along with chromatography, LC, GC, and ICP-MS instrumentation. And the third and the final part is the analyzers. So a lot of the routine testing that is done, for instance, glucose, HbA1c, etc., requires us to use the standard analyzers, Roche, Cobas, Beckman Coulter, the standard analyzers that you'd find in any other lab. And we use that for this purpose. So within these three technologies, we are able to offer all the different analytes that are required for a fully functional medicine lab. And interesting thing is, there are a few signups still available. If you want to sign up and go look at the lab, you can look at all these technologies in action in our lab today and tomorrow. There's about 5 tours that are planned, but there are a few seats still available. So if you want to sign up, you could go to the registration desk and check it out. So I step into the first technology aspect where I'm talking about the peptide microarrays. Vibrant started as a technology manufacturing company, and we manufactured peptide microarrays initially. And the first disease that we picked was celiac disease. And we are very glad that, looking back, that's one of the best decisions we did as a company, because celiac disease sits at the intersection of food sensitivity testing as well as autoimmune conditions. So in celiac disease, for most of you familiar, but it's generally the diagnosis is done based on antibody testing for gliadin and tissue transglutaminase. And if you have positivity, you go on and get a biopsy and then get a disease confirmation. So The issue with celiac disease testing was the serology had a lot of false negatives, and the sensitivity of testing was about 80 to 90%. So for every 100 individuals that get tested, you will have around 10 people who are not getting the antibody positive, and hence will never get a biopsy done. And they go on and on for several years until they get their diagnosis, right? On average, it's been predicted that for celiac disease, the time for diagnosis is about 3 to 12 years in the US. So we wanted to solve this problem, and we had the right platform to do it in the form of our peptide microarray. So what we did here was we actually took the entire of wheat proteome and tiled the different proteins that are there as peptides in our peptide microarray. And long story short, we worked with Mayo Clinic on this, and we got very well characterized samples that we ran on our peptide microarray. So the microarray to start with had more than 200,000 peptides, but we were able to selectively bring about around 300 peptides, which could reliably differentiate celiac disease from healthy controls and other similar diseases with greater than 99% sensitivity while maintaining specificity above 99%. That was the initial success that we got with our own technology. And this really got us thinking in the space of food sensitivity, because a century ago, if someone had told you that eating a particular food can result in an autoimmune condition, they would probably be laughed at, right? But celiac disease provides that interconnect between developing antibodies towards a particular food and then eventually ending up with an autoimmune condition. And this got us thinking on other highly consumed foods which are industrialized, for instance, corn, your dairy products, etc. And we made peptide microarrays for each of these, and that's what we offer as food zoomer testing. We have about 8 of these. This is again a slide showing the peptide microarray manufacturing process, where the silicon wafers are actually coated with thermal oxide, and we have photolithography to individually couple amino acids at different places along the wafer. So when you have a sequence of amino acids, you can selectively choose the spot you want to couple an amino acid in, and with iterative process, you can grow different peptides in different regions on the wafer. So that's really the peptide microarray manufacturing process. And this slide actually shows you how a protein is converted into a peptide that is grown on our peptide microarray. So any protein, typically in the food space, proteins length are around 200 or 300 amino acids. You basically twist the protein and have a linear sequence of amino acids, and you can create slide libraries of these proteins and grow them in your peptide microarray. And eventually, when you test for antibodies towards these, you will be able to accurately say which part of the protein you're actually getting reactivity towards. So once we developed the microarray for peptides, we also looked at food sensitivity testing with general extracts. And once we had those assays going, about a year and a half ago, we actually ran a food sensitivity clinical trial. You could look this up on clinicaltrials.org. It gives you the elaborate procedure on how we recruited patients. We worked with about 6 practices across the US, and people sent in samples, and based on the test results, they went on a food avoidance diet. And then we measured the pre and post antibody levels, and also had like questionnaire-based assessment. So if you look at this Venn diagram here, it'll show you that across all the 3 metrics, the antibody levels in individuals, the symptom severity score that the patient self-reported, and the global assessment that was done by the provider, across all the 3 metrics, we saw uniform improvement above 80% and 90% in most cases. Here again, we see in the different groups that saw significant improvements, how the symptom severity score actually correlated with how the patient really felt. So while working on the peptide microarray, it became amply clear to us that there is requirement for protein microarrays to look at 3-dimensional conformational epitopes on antibodies. So we got working with the same silicon wafer. So a picture is generally worth 1,000 words, and that's truly the case with this one, where you see on the left you have multiple wafers, and these are wafers that look similar to the compact disc that we used to have on our PCs, just slightly bigger. And on these, we actually grow proprietary surface which makes it adhesive to proteins of interest. So we have different kind of surfaces for different proteins. For a hydrophilic protein, we have a particular surface. For a hydrophobic protein, we have a different surface. So once we coat this wafer with the protein of interest, we can then dice the wafer into small chips. Now, each of that chip is going to have a small amount of protein sticking to it. And essentially, that makes it a microELISA. So I can do this process iteratively depending on the number of proteins I want to multiplex, right? So if I'm interested in 10 different proteins, I will start with 10 wafers. And then each wafer, I'm going to couple one protein at a time. And then when I dice it up, I'm going to have a bunch of chips of each proteins. And then it becomes a a la carte solution where I pick each protein that I want to multiplex and put it on a pillar plate as shown in the figure on the right. And when this pillar plate is actually, the story of development of the pillar plate is for another event in itself. But the pillar plate essentially can go into the standardized well plates that we have in clinical laboratories. And this really enabled us to automate the whole thing and take it into the lab right away. So once we got done with manufacturing of the protein microarray, the main test that we wanted to go after was Lyme disease. And Lyme disease is a prime example that is very well suited for a protein microarray because the standard of testing was still Western blot or immunoblots. And both these tests rely on using recombinant proteins which are sprayed along the length of an immunoblot, or they involve lysing a particular bacteria on a gel surface and applying an electrical voltage to separate out the different proteins and then testing for antibody. There are several disadvantages of these methods which lead to inaccuracies, band overlaps resulting in false positives, and improper separation of proteins causing false negatives. There's basically a lot of issues with the blot-based technique, and it's not really conducive in a clinical laboratory setting to be running Western blots and immunoblots. So with our protein microarray, what we essentially did was we had the different proteins that were of interest in Lyme disease and coupled them one chip at a time and multiplexed. It's one thing to have this cool methodology and developing a protein microarray, but it's very important for us that clinically it makes a big difference. And we collaborated with the top researchers. I want to shout out for them here. They sent out very well characterized infectious disease samples. And long story short, we were able to match or better the sensitivity and specificity of testing for each of this infectious disease. This is kind of like this slide here is the top layout of all these different chips and what are the proteins, peptides, etc., that are coupled to them. You will see we test not only for Lyme disease, but we can also test for other tick-borne infections at the same time. So typically in a tick bite, it's been postulated that a tick will transmit up to 6 pathogens at the same time. Right now, there is no test in the market that can actually test for all of these at the same time. And with Vibrant, we are not only able to test for the top 6 pathogens, we actually offer the assay for the top 15 pathogens that are out there. And the beauty of this architecture is any future pathogen that comes up or a new antigen is discovered towards which antibodies can be generated in infectious disease, we just need to make that additional chip and place it here on the pillar. And that's really the flexibility that our platform brings. As you can see, this platform can be used for several other uses as well. We have collaborations with a research group from Brazil on alopecia testing. There's a bunch of antigens they wanted to test antibodies towards, and we have some interesting results that are getting published in the coming months. We also work with Cleveland Clinic in differentiating aplastic anemia versus PNH. So a lot of clinical applications, and depending on what needs to be tested, this is a very flexible platform to make that happen. So we looked at the peptide microarray part of it and the protein microarray. The third important pillar is mass spectrometry. in mass spectrometry, the way to imagine the instrument is two components to it, right? So there is a chromatography part, and there is a part for the mass spec. This is typically used for small molecules that are less than 1,000 daltons in weight. So when you look at different matrices, such as your serum or urine, etc., you're going to have a lot of different molecules floating around, and oftentimes these molecules have masses which are very close to each other. So if you just directly load them into a mass spec, you're going to get a lot of noise. So that's where the chromatography part comes in, where it's similar to a queuing system, which is going to put your analytes one after the other and then load it into your mass spec instrument. So in the mass spec instrument itself, after the analyte gets in, it's ionized, and then you produce a mass to charge ratio. And depending on the mass to charge ratio, the analyte strikes a detector, and you get a mass spectrum in the very end, which will help you characterize the amount of that particular small molecule in the matrix of interest. So this is an assay that we use for tests such as micronutrients. We have an assay for 37 different micronutrients across vitamins, minerals, amino acids, fatty acids. We also use it for toxin testing. Under toxins, we have PFAS, heavy metals, environmental toxins, and several other in the pipeline. So moving on, under mass spec, we worked with a research group based out of Italy on colorectal cancer, and we have some interesting initial research findings. So we measured 37 micronutrients in these individuals with colorectal cancer and also compared them with healthy controls in this university. And what we were able to see was the level of copper that was measured in these individuals, and also the level of zinc was directly associated with the TNM staging. In colorectal cancer, you have stagings that are done depending on how severe the disease is and how aggressive it is. And we were able to actually pinpoint that these two micronutrients were heavily influencing that. Based on this results, we are actually collecting a much larger cohort of samples, and you should hear from us on this further research in the months to come. So overall, right now we looked at the three pillars, the technology and the research part. We looked at the peptide protein microarrays that we have, and then the proprietary assays that we developed in mass spectrometry, and then we had the routine analyzers. And we looked at the research we have done with peptide microarrays, protein microarrays, and mass spec. Going forward, I'm going to talk about the products that we are coming out with. So one of the first products that will be launched by us in the coming months is Hormone Zoomer. We already have a test panel for urinary hormones, and in that we are currently testing for the hormones and their metabolites. So this test in itself is going to be helpful in determining the type of HRT therapy that can be provided to individuals based on the metabolites of the hormones. But additionally, we see that a lot of this testing is actually happening in individuals who are in perimenopausal state or postmenopausal state, and it's very important to measure the bone health in these individuals. Right now, the best markers that are available to measure bone health are DPD and PYD. So these are essentially metabolites that are excreted in urine when your bone is actually getting regenerated. So in your bone, the collagen fibers are actually cross-linked by pyridinone. And when there is resorption of the bone that happens, basically your osteoclasts and osteoblasts in the bone, they work to rebuild the bone structure. You are going to have these excreted in urine. So this is an assay that we are going to be bringing about, and it'll be part of Hormone Zoomer. Another interesting thing that we've come across in the hormone disease space is a lot of people are not getting the required output with HRT treatments, and one of the most possible reasons for that is the presence of xenomolecules which behave like hormones. And we have a panel of 8 toxins that we are going to be including along with your urinary metabolites as a part of Hormone Zoomer, and that's going to help you really differentiate if there are other players which are affecting your HRP treatment methodology. Principally, I have a few mentioned here: BPA, MEHP, which is a phthalate, and also triclosan. These three are known to have decreased the bioavailability of the hormonal treatments that are given. So moving on, I want to talk a little about oxidative stress and the improvements that are coming with that in our panel. So oxidative stress is one of the first tests that came to mind when we slowly started pivoting towards being a longevity lab. Because there is a whole theory on the oxidative stress theory of aging, where your cells are gradually decaying, and that's essentially what is causing your diseases of aging. And then they develop into chronic conditions, which ultimately reduce your health span and lifespan. So in oxidative stress, it's always a balance between the antioxidants and the oxidants that are produced in your body. So whenever you breathe, the air is processed through your mitochondria to actually produce ATP, and your body produces superoxide, hydroxyl ion, and hydrogen peroxide in the process. This, as long as you're breathing, you're going to have some amount of oxidative stress. But the body's innate system has enzymes that are defending you against it. And that's what is indicated in this flowchart right here. If you see the O2 minus, that's your superoxide, and that along with the hydroxyl ion is going to attack your lipids and form lipid radicals. So the lipid radicals have to be stabilized into stable lipid products, and this is primarily done using the glutathione cycle. And you will see glutathione is basically taking the hit away from the lipid radical, making it a stable lipid, and it's actually getting oxidized in the process. So this conversion of glutathione between reduced and oxidized form is managed by two enzymes, glutathione peroxidase and glutathione reductase. So mutations in these two genes can actually affect the way you neutralize these radicals, and it basically decreases the efficiency, so you're more prone to oxidative stress. Same way with your superoxide, you have your superoxide dismutase 1, 2, and 3, which have mutations that we can measure. And there again, we will check the efficiency of how well you're able to process your superoxide. The superoxide, after getting processed to hydrogen peroxide, is still a major oxidative stress component, since hydrogen peroxide is extremely volatile and it can actually pass through membranes and attack neighboring cells as well. So hydrogen peroxide is processed by two enzymes, catalase and glutathione peroxidase, against which we are also looking for mutations, and that's checking the efficiency of that conversion. So that's the genetic part of it. And this here actually shows the actual damaged products that are produced when there is oxidative stress in the body. So we divide, when you look at the cell as a whole, the main sources where oxidative stress can affect the cell are four. One is the lipids, the second is DNA, the third is RNA, and the fourth is protein. So all four of these major macromolecules in your cell can be affected by oxidative stress. And what we measure are analytes that are actually downstream, which are excreted in urine when each of these components are affected. There are about 15 to 20 markers that we measure in here. One additional thing I want to mention, even though currently for oxidative stress, what's out there in the market is basically MDA, lipid peroxidase, and 8-OHDG, which is a very limiting panel. So we have advanced markers like your dityrosine, which is shown to be accumulated in the amyloid plaque, tau tangles, etc. And we also have a direct way of measuring MDA. So the T-bars assay, that's currently the standard used out there, has several disadvantages because the process, the assay in itself is involved at a high temperature, and that itself is going to produce a lot of aldehyde, and it can give you falsely elevated levels of MDA. So with the oxidative stress, what we have right now in the market is the genetics and the damaged products. We are also going to be bringing in antioxidant enzymes, where we are measuring things like superoxide dismutase directly in your serum, GPX in your serum, heme oxygenase in your serum, which will add a lot of value to see the actual snapshot of how these enzymes are working real time in your serum. Moving on, after the hormone zoomer and oxidative stress, we are looking at gut metabolite. So many of you here are probably familiar with our Gut Zoomer product. So the Gut Zoomer product currently has your commensals, your pathogenic bacteria, inflammatory markers, and then a small set of metabolites in the form of SCFA and bile acids. This is a very limited set. What we intend to really bring on here is your secondary bile acids and a large set of metabolites for indole and its derivatives. We are also working on assays for polyphenols, the downstream metabolites of polyphenols. We are going to have a panel for that. And even within, the other families that are present, like the amino acids, there are metabolites such as LAC-Phe, which is a marker for satiety that we are bringing on into our, next upgraded product. And one thing I wanted to mention here, why is there an importance to actually measure the gut metabolites? So the behavior of bacteria is extremely dependent on the community in which it is. So the same bacteria can produce different metabolites depending on the other bacteria that are actually along with it. So it's very important that we measure the end product of all this bacterial metabolism. And it is even more important that all the metabolites that are produced, the ones that are absorbed and that which are circulating in serum, are even more important because that's going to have more of a biological effect. So moving on, I'm going to talk about some of the post-translational modifications and why that is of particular interest to us. Pretty much everyone here is familiar with the term epigenetics, which is the addition of a methyl moiety to DNA, which doesn't change the sequence of the DNA, but it changes the way it behaves. The actual corollary to that is the proteins have something similar happening, where different groups are attached to a protein, which actually changes its function, but it's not actually changing the amino acid sequence in itself. So that is a major area of interest to us, and we are really rooting for this because there is very good assays available to do in LCMS and really predict the behavior of a protein and then correlate it with diseases. So the particular mutations that are of interest to us are phosphorylation, acetylation, methylation. Phosphorylation is majorly to do with your cell cycles and how different kinases, etc., are activated within your cell. For acetylation and methylation, it is to do with how your gene expression is read. With glycosylation, how the protein adhesion to different surfaces are affected is based on glycosylation. And ubiquitination is actually attachment of the ubiquitin group to mark a particular protein for destruction. So all these are very important assays, and we are working on all of these on specific proteins for different disease conditions. So with that, I want to go on to CardioPro. This does measure some of the post-translational modifications, and the PTMs are going to be a key part of CardioPro and NeuralPro that I'll be talking about. These are the set of markers that are going to be offered under CardioPro right away when we launch it in a month or so. So we have a metabolic risk panel, which has your standard metabolites, HbA1c, glucose, HOMA-IR, insulin, etc. We have the standard lipid panel, SD, LDL, LP, little a included, and some of the key ratios that need to be measured. We also have ceramides and the ratios which are being found to be independent risk factors for cardiovascular disease. We also have the redox risk, where specific oxidative stress markers that are in urine, which have been associated with cardiovascular conditions, they have been put in a panel as well. We are also looking at inflammation with hsCRP, IL-6, TNF-alpha, and clotting risk with D-dimer and fibrinogen. We also have an important marker, galactin-3, under atherosclerotic risk, along with MPO, plaque, ox-LDL, and oxidized phospholipid. We will also be having a panel for sterols, desmosterol, lanthesterol, etc. Desmosterol is a key marker where if someone is on a statin therapy and their desmosterol levels are actually dropping significantly, it could have downstream effects in where they could have neurological conditions. So it will help optimize the treatment regimen for different individuals. So that's the CardioPro marker list. Along with the markers that were listed there, we also have around 100 SNPs that we will be measuring, and these SNPs are for different packages. So there's one package for just the standard lipid markers like your LDL, IDL, VLDL, chylomicrons, etc., which directly affect how the marker behaves or how the marker is metabolized in your body. And then there is a panel for just drug metabolism, drugs associated with cardiovascular disease, such as your statins, your PCSK9, etc. We have drug metabolic strips there, aspirin, etc. And then the third part is basically your hypertension SNPs. So in hypertension, we have put together a fantastic marker set for the RAS pathway, where we're looking at important mutations that affect the conversion of angiotensin 1 to angiotensin 2, etc. And based on those mutations, we will provide supplement recommendations which are personalized to the individual. A figure here that's there on your screen, it's a theoretical layout of how we are going to present the cardio markers in itself. You will see that from food and the liver, you have intestinal absorption and chylomicrons going through your artery. We are going to be looking at mutations in apolipoproteins such as C3, C2, etc., and LPL, which affect the conversion of your chylomicrons into VLDL. Basically, chylomicrons have to get rid of the triglyceride molecules that are present in them, and these mutations prevent that from happening. So those are important genetic markers that we will be testing for. We are also testing for mutations that are associated with ApoB100, LDL, IDL, VLDL, etc., and how these different markers are processed within the body. We also have the figure here, which basically shows the endothelial dysfunction markers. We have assays for ADMA and SDMA that are going to be part of the CardioPro marker set we have. So your SDMA and ADMA, they are basically inhibiting the production of nitric oxide in your body. Nitric oxide, as you know, is very important component in vasodilation, and it's very important so that you have a good vascular tone. Your arteries are nice and supple, so your blood can flow freely instead of having rigid arteries, which is also going to increase your risk for hypertension. So SDMA actually prevents the entry of arginine and homoarginine into your endothelial cell, and your ADMA is preventing the nitric oxide from processing them. So these two together, along with actual measurements of arginine and homoarginine, it's going to give us your vascular tone status. So in the future, what we discussed until now is what the current version of CardioPro is going to have. In future, these are the markers that we are going to bring about with the CardioPro. If you look at a simple LDL molecule, it has several components to it, such as cholesterol ester, phospholipids, the ApoB100 protein, triglycerides, etc. Until now, the markers for oxidative LDL are twofold. So you have assays for ox-LDL and you have assays for oxidized phospholipids. Both of these assays are based on antibodies that have been generated against these molecules. And the real issue why it hasn't come about to be the marker of choice and widely used is because the assay for oxidized LDL has not been standardized. There are several components in the LDL molecule that could get oxidized, and depending on that, the functionality of the molecule will be different. So if you see here a LDL molecule which has minimal oxidative damage, it's called minimally modified LDL, which has maybe a few phospholipids oxidized. It is still going to be able to bind to the LDL receptor and being taken up. But when you look at more extensive oxidation, that's when the protein, apolipoprotein B100, the phospholipids, phosphocholine, phosphatidylcholines, etc., get oxidized. And then the molecule in itself is no longer able to attach to your LDL receptor and is taken up by scavenger receptors that are there in macrophages. So this is a very important distinction, where if you just measure for limited number of components with respect to the phospholipids, you're not going to get the full picture. Apolipoprotein B100 is about 4,000 amino acids in length, and it has a variety of amino acids, specifically lysine, methionine, arginine, and tyrosine, that are there along the sequence of amino acids in ApoB100. So these are easily prone to oxidation, and what we are developing at Vibrant is specific cut peptides of this ApoB100 and specific sites which are getting oxidized. We are mapping it to individuals who have CT angio data. So basically, we are trying to see, depending on the oxidation site, is there a higher chance of your LDL actually penetrating into your artery? And we are also checking for, if the LDL penetrates the artery, depending on the site of oxidation, is the retention time that it stays inside the endothelial space is increased. So this will really give us a clear insight into why certain people develop atherosclerosis and why certain people who are walking around with LDLs of 200 have no issue with artery deposition of your LDL. And along with ApoB100, we are also going to be looking at different peptides along the other 12 apolipoproteins. That's also going to be part of the future version of CardioPro. Moving on to Neural Pro. So Neural Pro, the structure is going to be very similar to how CardioPro products was launched. So we have a set of genetic markers that we'll be testing for, and we also have direct measurements, markers of dementia, such as your amyloid beta 42 to 40, the ratio of that. We are going to be measuring total tau and also phospho-tau, specifically the sites 181, 217, and 231. And additionally, we will also be having tau acetylation sites, because tau acetylation has also been shown to cause tau aggregation and eventually leads to dementia. One interesting angle within Neural Pro is we also have a large toxins panel which can come along here, heavy metals, your PFAS, your environmental toxins, and microplastics in an assay we are working on in the toxin space, and that should also be something that we offer next year. So we want to package the genetic components, the actual serum markers or CSF markers, and then we look at the toxins all together as a complete package for neural health. So in summary, we've looked at some of the main assays that are in development, which are going to be launched this year or next. And we, apart from the tests that we discussed, there are several others that are in the works within Vibrant. I'm really excited about the metabolites of DHA, EPA, and arachidonic acid, and how the ratios of these metabolites can actually tell you whether you are at a pro-inflammatory status or an anti-inflammatory status. I'm also very interested about thyroid health, where we are looking at mutations in deiodinases and actually mapping the thyroid cycle along with RT3, and how the different enzymes which are supposed to remove the iodine molecule differ, and that'll be an interesting assay to see. In mitochondrial function, we are developing assays for mitochondrial membrane potential and mitochondrial mass. Membrane potential essentially gives you the efficiency of your mitochondria, and mitochondrial mass is going to tell you the number of mitochondria that you have in a cell. On average, you're supposed to have around 5,000, but this is going to indicate relatively how many mitochondria that you actually have in your cell. So in summary, we are very excited about all these tests that we are coming up with, and we can't wait to see what the providers are going to be doing with it. We are very excited how you're going to script the personalized longevity story of all patients, depending on the assays that we are going to be bringing out. Thank you so much.